And we are so excited to welcome Shannon with Nebraska LTC Pharmacy today. We have a wonderful partnership with this organization, and a big part of Home Care Partners of Nebraska's goal is to reduce hospital readmissions to help improve patient outcomes. And a big part of that is medication management and medication monitoring. So we're excited to talk to Shannon today and hear about what she's seeing in the industry and how this pandemic has affected her model and her clients and what her team is doing differently. So Shannon, I'll let you introduce yourself and tell us a little bit more about the role that you play.
Yeah, so as Karla said, I'm Shannon with Nebraska LTC Pharmacy. So we kind of have a unique setup. We're doing things that I'm not aware of any other pharmacy doing. So what we do is we focus on compliance and adherence, and it usually starts with some sort of referral. Maybe that come from a hospital discharge, it might come from an adult child, just where somebody is needing a little more help with their medications yet want to stay home. So we usually schedule an initial consultation, and I go to the patient's home, I meet with them. Right now we're doing things a little different with the current state with the COVID. We can do a lot of these things over the phone. I've had an adult child FaceTime me, and we've gone through the process together with the daughter. But what we're doing is we're sitting down, we're going over a hospital discharge sheet, we're cleaning out the old meds, we're literally combing through and making sure that all that you have left is what you are supposed to be taking on your current regimen. So then what we do after that is we take everything and we blister pack them into weekly compliance packages to ensure that you're always getting the right med at the right dose at the right time with the right frequency. So we try to eliminate any room for error. So that's kind of it in a nutshell. It's a lot of hands-on. We're extremely accessible, and it's been a really, I guess, awesome kind of thing that we've been expanding and working with several other groups, and it's been a pleasure to work with you guys. We hope to continue that. And one thing that I'm hoping is, with the way things are trending now, is that it's something we're just able to learn and expand and just keep maybe bringing in new maybe pieces here and there to kind of just keep this going and keep this expanding. So it's a learning game at this point for all of us.
It absolutely is, and things are changing quickly. But you're right, that model of safety and convenience is so extremely valuable in a time where, you know, we're really, as far as a senior or vulnerable populations, are really not leaving the home. And so having those things brought in is so fantastic. Now, you mentioned, Shannon, we were talking about your team that delivers. I'm sure they're seeing a lot of differences now than they did a couple of months ago as far as somebody's day-to-day or their just their activity and what they're doing and some of those concerns that they're seeing. Can you talk a little bit more about that?
Yeah, so we're trying to make it as consistent as possible. So we're trying to make it, one thing that we see with the elderly population is consistency is just key for them. So we're trying to keep it as consistent as possible. A lot of times we are going into the homes, we are sitting down with them. It's not just a delivery. You know, we're going over things with them. It's an education piece. It's not just oh, here's your meds for the week, we'll see you next week. So we're just trying to keep them very educated. We're trying to make sure that that personal connection isn't lost with this. That's one thing that we try to be an advocate for. Is I think the personal connection is missing so often. Doctors are busy, you know, you get a very short snippet of their time. Pharmacists are the most accessible healthcare providers. So we're trying to keep it so that we're still extremely accessible. If it's something where you don't want us coming in the home right now, that's totally fine. We can set that up differently. We can leave it on your porch. We're doing a ton of porch deliveries, and then I'm just trying to connect with them through, you know, a different mode. If it just be FaceTime, or even if they're just, you know, wanting a phone call. So we're trying to keep things as consistent as possible because we want to make sure that we're still providing that same level of care. there. We don't want to be missing any pieces.
So Shannon, what are some opportunities right now for families that are maybe used to helping their parents with their medications that aren't able to do that right now? What does that look like, and how can you help them?
Yeah, so we can definitely help them. We've gotten a lot of new clients and new relationships with this. It's common for an adult child to be helping their parents set up their meds. Maybe that's not possible right now. So we would love to be able to step in. We can set those meds up for them. It's an extremely easy process. It's just a matter of letting us know what pharmacy you're currently using. We contact your doctors to make sure that we've got an updated med list. We do all of the work for you. We'll simply set the meds up. We'll deliver them right to your house. So it's something that we can definitely take off the shoulders of those adult children, whether they live here in town, or we get a lot of calls from people, they live across the country and they just want to ensure that their parents are still getting what they need, because maybe it's just a matter of they can't get out and go to the pharmacy. So we can definitely take that off their hands. We're extremely flexible as far as meeting certain needs they might have. So it's just a quick phone call to get that set up, but we would love to be of help with that.
Well, I didn't know that you were able to do that. I'm sure there's a lot of people that live in Lincoln that their parents live somewhere else, that their parents are usually going to the pharmacy and they're not right now. And so that would be huge.
Yes, for several reasons. Just a matter of the no contact. I know with the larger pharmacies, they have some people set up on maybe like an auto refill policy. And I just ran into this actually yesterday. This patient had some compliance issues in the beginning, so he doesn't need his meds set up on auto refill because he's got a big supply of them. We're working on that compliance piece with him, but Walgreens, still has them set up on autofill. And so they sent the patient a text message. And so he's thinking, well, I need to go get this medication. So he went out, no face mask, no gloves, no washing his hands when he got back, nothing. And he picked up this medication that he didn't need because it's just an education piece. He didn't need to go. So we're just trying to remove that contact. We're trying to remove that error of now having that additional bottle sitting there of medication that's now potentially a risk, because is he going to double dose? He doesn't need that sitting there. So we're just kind of trying to help simplify those pieces in any way we can. For that particular patient, we just made a little delivery run over to his house and we got all of those unnecessary meds out of there. But there's just several things where, we don't need to be getting out with that population if we don't need to. Plus it's a confusion. We have a very streamlined process. So anytime there's a new med added, a med taken away, we're sending out messages to all of the doctors so they all have a current med list. We like to keep everything very neat and tidy. So we always want everybody to be on the same page.
I think one of the last things that I have, a question for you is just on the topic of compliance. And so one of the clients that we've served together, was a husband and wife, and they are taking some medications during times that our caregivers are not there. And they were having difficulties keeping those straight between whose medication belonged, taking each other's medication accidentally and having medication errors. And when we started working together, that really changed a lot. And, to kind of talk about in a similar scenario, how did you do that?
Yeah, so it's really pretty a simple process. It's just we sat down with them, we met with them, we sorted through everything. And what we also like to offer is just a med cabinet clean out. So we go through any and all old meds, things that have been discontinued, and we get them out of the house. And then it's just a matter of sorting the current meds into, okay, this is his, this is hers, just keeping them separate. So then we kind of took over the packaging and we just packaged them into a week at a time. So they're nice and neat and organized. And it's been really very helpful for them, because it just gets confusing for anybody when you have all of these bottles just sitting there. You're supposed to sort through them. They may or may not have been getting the education they're needing on these meds as to what is this for? What is this exactly treating? Mm-hmm. When should I be taking this? Should I be taking this with food? So there's a lot of just educating, and we can kind of simplify that when we're just packaging them all up. We can include any notes we might need on there. So it's been a really nice process, and it's been fun to see them staying on track. And I think their health has drastically improved because they're getting the right meds at the right time. So
I think one of the other things they maybe mentioned they liked, if I'm remembering this correctly, is they've got their, on those packs that are packaged, it's got their name and their picture, so they can't pick up the wrong one. Is that right?
So yes, so it's pretty, it's hard to mess them up. So everything is laid out very nice for you. Descriptions as far as to what each pill looks like. It just works really well. It's trying to remove that error, as I mentioned earlier, trying to remove the possibility of there being error. So the only thing missing, which is where you guys can come in, is we can't be there to give you that reminder. And so we really appreciate that with you guys, and having the caregivers in there. That's something to help continue our process from beginning to end, is that last step of actually taking the meds. Because if we're not taking the meds, obviously we're not getting the benefit. So we very much appreciate your caregivers for that.
Well, thank you for your collaboration, and it is huge, the reconciliation, setting things up to reduce the risk for error. And then, like you said, Shannon, how important that human element is to still hold somebody accountable, to make sure you're taking the right thing at the right time, and then that closing that communication circle. And whether that be the benefit of having care management when your adult daughter or son or whoever it is in your family isn't right now available to do that supervisory visit that they normally would, and so forth. So just knowing that they've got partners that are going to help keep their loved ones happy, healthy, safe, and a proactive way to make sure that they're doing the right things for their health.
Absolutely.
Well, thanks for joining us, Shannon, and we look forward to working with you in the future, and appreciate the model that you have and keeping seniors safe at home. And we will look forward to talking with you again soon.
Okay, great. Thanks for having me. As always, we appreciate you guys and the work you're doing. So take care.
Thanks, you too.
Bye-bye.